What up, humans? My name's Flash Patel, and I am the host of Health and Humanity. This is our second episode in our Basics of Medicine series. In this episode, I am going to talk about how you can score that honors in your rotation, specifically things that you can do. So there's one big tip that you can do. During every rotation, whether it's third year or fourth year, you're gonna be handed patients. Fourth year is just the same as third year, except it's a lot more fun and you're given a little bit more responsibility. In third year, if you're handed patients, you are expected to know that patient inside and out. You're expected to know their story when they came in, why they came in, what they're getting treated for, all their medical illnesses, etc., etc. But the one thing that you also have to do is kind of think on your feet and diagnose based on what you think is going on with the patient, all right? The best way that you can learn from this is make sure you read up on every single patient that you have. Now, there's a way that you can hold yourself to this. What you can do is every morning when you're rounding, have an article or something that you looked up ready for every patient that is going to guide your plan. When you present that patient at the end and you're going through the assessment and plan, you can say, I looked up this article last night and I learned this, and I think we should do this for this patient. If you do that for every single patient, you will score honors. That's all you need to do. You just need to go home, look up a quick article. You can use PubMed. You can just use whatever resource you want. Find one article straight from the source. I don't mean looking stuff up on UpToDate or Dynamed. I mean something straight from the source. That will impress every single attending that you have without a doubt. And that is one way to score honors without looking like a douchebag or having to take other people out. All right, fine. You might look like a douchebag sometimes if you always come up with an article. But if you do this more than 50% of the time, I guarantee you should score honors if you perform well in all the other aspects of the clerkship. Now, I just want to really quickly talk about resources that you can use to look things up. Now, I said UpToDate and Dynamed. Most people just go straight to the computer, go to UpToDate. It's like the Wikipedia for doctors, all right? So they go to UpToDate and look stuff up. Dynamed is also very useful, very good, straight to the point. You can use Dynamed as well. Now, I know a lot of students do this. They go to Google. They just Google the question and then use that answer and trust it. But you have to be careful because when you Google something, the first thing that comes up is WebMD. And is WebMD really credible when you're treating people? I don't think so. So make sure you're using validated, peer-reviewed resources for your answers to any question that you have. Now, when it comes to apps on your smartphone, there's a ton of them. You can have UpToDate on there. You can have Dynamed. Look it up. There's a way you can get access through your institution. However, you should also download and install Medscape. Medscape is very good because it helps you with medications. Now, Athena Health bought over a company that has their own app that also does medications and has a pill finder, but Medscape has the same thing. The good thing about Medscape is it bullet points through the pharmacology or the usage and dosage of these medications. So I found Medscape extremely helpful. They even have calculators that you can use, for example, creatinine clearance or whatnot. So yeah, number one rule that you need to use and follow is make sure to look stuff up and go to real resources and then present that you looked it up. You can practice presenting it in a way that doesn't make you sound cocky. You can practice it in a way that makes you sound confident. And if you do that, you will score in honors without a doubt. All right? If you have any comments, please post below. If you like this video, hit that like button. If you dislike this video, hit that dislike button. Either way, forever and always, be human. We'll see you next time.